Okay, good morning once again, ladies and gentlemen, and welcome to today's training session. This training session is about undocumented citizen administrator. My name is Mbeki Ndlovu, and I'm part of the program management team. We'll be assisted to deliver this training by Archie, who is going to be also helping with this session. I'm going to share. I've shared my screen. I hope you can see my screen.
Yes.
Okay, thank you.
Yes.
So this particular training session, I think I understand that some of you might be attending EVDS training for the first time, so I decided to include a slide which tries to give us a background on where we locate undocumented citizen administrator role. So this particular on this particular time, our agenda is that of covering introduction and welcome, and then we'll touch on the overview of EVDS. We'll then give you a chance for question and answer, after which we're going to do a system demo for undocumented citizen administrator role, and then we'll have question and answer again after which we'll talk about the user support package and go through some troubleshooting issues or have you try. The objective of this particular session is that of providing an overview of what EVDS is about and also making sure that you understand your role on the ecosystem and where it's located. We hope to give you knowledge and skills that should help you to confidently interact and find your way navigating the system. We will make sure that we also provide direction on where you can find support materials. After the training has ended, you certainly need some materials that you can go to and get better in terms of understanding your role. And then, of course, we'll make sure that we provide moments for people to ask questions, and then we, as much as possible, try to also provide answers. This being a virtual session, we want it to be as engaging as possible and to make sure that we stick to time, but also for participants who wants to raise questions, we ask you to post your questions on the chat box or raise your hand, and then we can actually will assist in making sure that he alerts me if there are some hands, and then we can try to give moments for people to ask questions or to make comments. And we also want you to participate as much as possible and make sure you avoid anything that could be distracting your attention towards during this particular time. So I decided to start talking about EVDS and making sure that we all understand what EVDS is. So what is EVDS? EVDS is an electronic vaccination data system, which aims to provide an authoritative registry to track COVID-19 vaccination metrics towards the control of the pandemic. So it's an officially adopted centralized digital system, which allows us to capture all vaccination events at official vaccination sites and provides data analytics through built-in business intelligence. There are quite a number of users that we find on the EVDS. You can see that there's quite a lot of them with different color codes, 4 different color codes, as you can see. But the function and benefits is that on the function side, we say that the system allows us to assign vaccinees with a site, date, and time slot for a vaccination. It allows us to capture data, patient information, safety information, details of vaccine sites, records progress, reconciles payments, forecasts supply and demand, and standardizes processes, which means that there are no third-party workflows permitted. It ensures consent, that's on the benefit side, ensures consent is given by vaccinees during the process, drives efficiency and quality, assesses liability and any other risks, ensures equitable access, protects data, provides input into other systems, such as the supply chain management and NICD, provides live monitoring of coverage, effectiveness, safety, and durability. It streamlines budget allocations and reduces vaccine wastage. Now, this is an important slide in as far as what we're doing today. It's about the components of the EVDS. Sometimes people struggle to figure out where each training session that we do belongs. So you can see that we have got 4 components here, starting with the master facility list component, and then followed by enrollment and scheduling. And then we have on-site EVDS, and then the 4th part is the information center. So the undocumented citizen administrator role belongs to this component, which is the enrollment and scheduling component. Why? Because an undocumented citizen administrator assists the process of people that do not have identification to get registered on the system. I think it's important for us to know where this particular training aligns or is situated. Later on today, there will be on-site EVDS training. So that is focusing on the patient administrator and the vaccinator training. So I think people need to remember and to understand the differences. Yet those components are linked to one another, but we have to understand how each component is related to another, right? So now, having said that, we can now focus on talking about the undocumented citizen administrator specifically, because I hope we can at least understand where it's situated. Now, right, I'm trying to move the slides. I don't know why. Okay, finally. So what is this undocumented citizen administrator role? This particular role allows us to upload individuals who do not have identification documents such as the IDs and passports. It's largely foreign nationals, but sometimes you find that even some South Africans who do not have identification end up having to be registered as undocumented citizens because they do not have identification as well. So the process involves generating an EVDS registration number for them so that they can get vaccinated. So when you go to health facilities, you don't go to health facilities and say, my name is so and so, I would like to be vaccinated. You go to a health facility, you produce identification, and then your identification number on the system is the one that will be used to pull up your records. So in other words, if you don't have a registration number or an identification number, it becomes very difficult. That is why in the case of people who do not have identification documents, we have to make sure that they have a registration number at least. So the undocumented citizens will be provided with this EVDS registration number after they've been uploaded into the system. This will allow for them to be scheduled for a vaccination. So once you are registered and you have your registration number, it's possible that you can go to any health facility and be vaccinated. You can get vaccinated your first dose at one site, and then the next time, as long as you have your registration number, you can proceed to be vaccinated at any health facility. Now, some important information. After a vaccine is administered, a vaccinee is given a vaccination card, which has got personal details and a vaccination code. This is common for everyone. However, in addition, for undocumented citizens, we need to make sure that the registration number is included on that vaccination card, because if it's not written anywhere and they don't have it, it's going to be difficult for them to have their second dose or a booster dose after the initial, right? So it's important that those vaccination cards that we issue, the registration number, that is in addition to the vaccination code, which is given to everybody else, we have to make sure that the registration number is added there where it says identification number. And the vaccinees who are registered and were vaccinated as undocumented citizens will not receive a vaccination certificate. So the system does not allow for undocumented citizen to receive a vaccination certificate. So it becomes important then for undocumented citizens to keep that vaccination card as proof of vaccination, right? So I think this is important. Now, moving on to our training agenda today, there are four things that would like to show you on the system. This is how to create a new facility on the portal. And then after you've created the facility, we need to show you how to share that facility. And then if you can share the facility, we also want to show you how do you register beneficiaries one by one, something that we call single upload. And then at the end, we have to be able to view all uploaded beneficiaries. I think those are the four things that we'll go through. Now, there's a system process that I would like us to talk about. Now, there are two scenarios. The first scenario is that support process when there is undocumented citizen administrator at the vaccination site. So the process that is followed when we have an undocumented citizen administrator at a vaccination site, right? So the starting point will be that a vaccine arrives and then COVID-19 screening happens. And after that, they get to meet a marshal who directs the vaccinee to the undocumented citizen administrator's desk. Important that this marshal needs to explain that the objective is to protect and not to detect, that no documentation is required and vaccinees will be, with no affidavit, will be assisted, right? Sometimes if the undocumented citizens take long on the queue and they are not being assisted, they might end up fearing for their safety or for they might be worried about being arrested, for example, and they might end up leaving. So it's important that you allay their fears. And once they get to the desk for undocumented citizen administrator, the administrator confirms that the vaccinee has no identification or an affidavit for missing identity documentation. And after that, they will proceed to capture the vaccinee details as single upload on the system. Once that happens, a registration number will be produced and it will be written down and given to the undocumented citizen. So this undocumented citizen or vaccinee can now join the walk-in queue. Walk-in queue is for people that do not have appointments. So they join the walk-in queue and then they get to meet a vaccinator who administers the vaccination to them. So that will be scenario number one, when you actually have someone who is a undocumented citizen administrator on the system, right? So scenario number two, supporting vaccination sites that do not have an undocumented citizen administrator on the ground. In this case, we say you use the virtual undocumented citizen administrator. So even when you go to a health facility anywhere around the country and there is no undocumented citizen administrator, we are saying health practitioners must be aware that it's possible to have that person registered and then get them vaccinated if you follow the process that follows, right? So now the starting point here is that the vaccine still arrives and then COVID-19 screening happens. And then the marshal directs the vaccinee to the facility administrator's desk. So this particular role of facility administrator has to be assigned to someone within a health facility, right? So in each health facility, you have to decide who is going to be our facility administrator, particularly for the purposes of assisting undocumented citizen administrator, for assisting undocumented citizens, that is. Now, what happens is that the marshal still explains that the objective is to protect and not to detect. No documentation is required, and vaccinees with no affidavit will be assisted. When the undocumented citizen gets to meet the facility administrator, they still confirm that the vaccinee does not have identification or an affidavit for missing identity documents. And then what the facility administrator does is that they have that responsibility of contacting the call center where we find the virtual undocumented citizen administrator. And that the call center number is the same as the EVDS call center number, which is 0800 29 029 999, right? The same call center number that we know. But when you're a facility administrator, you have to request for somebody who is going to assist you as undocumented citizen administrator. So now when you contact the undocumented citizen administrator, they will have to first verify that which facility are you coming from. They might ask you about your MFL code. They might ask you about something that helps to verify that indeed this is an existing health facility before they get to register an undocumented citizen for you, right? So once that happens, the virtual undocumented citizen administrator will capture information on the system, and then a registration number will be generated, given to the facility administrator, who in turn writes it onto the vaccination card before giving it to a vaccinee who joins. In this case, the vaccinee is the undocumented citizen who joins the queue, or the walk-in queue, and then gets to meet the vaccinator so that they receive their vaccine. So those are the two scenarios or processes that we have to be aware of that we expect to happen at health facilities, depending on the different scenarios that you find there on the ground. Now, this takes us to the system demo. What you see on screen is the website that is the web link that you follow when you want to log in to access the scheduling and the registration and scheduling system as an undocumented citizen administrator. So sometimes people see helium.mezzanineware.com. If you apply for the role of undocumented citizen administrator, you will receive an SMS that has got this web link. Sometimes you ignore it, expecting to see that you want to see the words EVDS, but this is actually the web link that you're supposed to follow, leads you to the system, and then you can start to access the system and do your role as undocumented citizen administrator. So at this point, I'm going to check if there are any questions and comments that maybe need to be responded to before I actually go on to the system and show us what happens down there. Okay, I see no comments and I see no hands, so I'm going to proceed. There will be an opportunity for questions in the end. I see only 13 people are registered right now. Can we please follow the web link on the chat and be registered for this training? It will be quite helpful for our records. Can you see my screen, colleagues?
Yes, Mpegi.
Yes.
Okay, thank you for that. Now, this particular system that I'm doing a demonstration on is a training website. It's not the actual site. I think we have to you have to be aware of that. Now, if you follow that web address that I showed earlier on, it will take you to a page similar to this one, because this particular system is 95% similar to the actual system. So this is a copy that we use for training. So after you've applied for the role of undocumented citizen administrator and it's been approved, you will receive SMS notification which has got your temporary password and the web link that you're supposed to follow in order to open to access the system. Your username is your mobile number, but it's your mobile number starting with a 27. So I'm going to put in my mobile number. And the temporary password that you receive expires within 72 hours. So you have to make sure that you log in within 72 hours. And what happens is that if you're logging in for the first time, that temporary password will have to be changed. So and you customize it to a password that you will remember yourself, because the one that you get from the system it might not be easy for you to remember, so you have to set up your own password. The next thing is that if 72 hours has passed after you received the SMS, and it tends to be a common thing, so you have to pay attention. Below the sign in button, you can see here there's another button for recover your password. So if you click on recover your password, it will take you to another page where you're supposed to provide your details before you get to receive a new temporary password, because the old one has expired. And then once you have that new temporary password, you can access the system. So in my case, I know my password, so I'm gonna log in now. So this becomes your landing page. We can see that at the moment it says occupational health administrator. This is the role. I've got so many roles on the system, but I want to make sure that the first thing that I do is select the role of undocumented citizen administrator, because I want the system to understand that at the moment I am navigating the system and doing my work as undocumented citizen administrator. So after selecting that, I click the refresh button, and then we can see that the functionality that I have here is that of managing facilities. So I'm going to select manage facility. So as soon as I select manage facility, it takes me to this part where it says at the top, manage facility, and then this is the list of facilities that I've created, right? The name of each facility, you can see it here, and then the location, the province, and the suburb also indicated. We also see that on this facility, which is zone 5, we have three people that are uploaded. And it's important that we take notice of this one because we'll check it later on. Now, where do we start? We said we're going to learn 4 things, which is create a facility, upload beneficiaries, share facilities, and then the last part will be to view uploaded vaccines on the system in totality. How do we get to view all of them and to view their details? So the starting point is, how do we create a facility? So we're going to create a facility right now. There's a button on the top right here. It says new. We click on this button. It takes us to this form where at the top it's written add a facility. We have to start specifying details of our facility. Status, we want this facility to be active, so we were not going to change anything here. Type, we have to change this. It says not specified, so we select undocumented citizen. Sector, we have to specify this, and we could choose public today. Registration number, I know that public facilities or even the private facilities have registration numbers, or even the NPO, if you choose NPOs, they do have registration numbers. So you can put in that registration number here. Name of facility. So you can name this facility after an existing facility that you have, but it's also possible to name it after another facility that you want to create on the system. Maybe you want to name this particular facility and call it and give it the name of the suburb where you're going to be working from, and where you think maybe a lot of people are coming from. Or so you can basically give it a name that is going to be easier for you to remember and for you to identify that, okay, these people come from this particular area. But in my case, I'm going to call this one, let me just call it zone 18. I was in Cosmo on Tuesday, so I'll say Cosmo City. Right, so clinic, let's call it a clinic. So I'm going to call it Zone 18 Cosmo City Clinic. That will be the name of my facility. And you have to add the contact number there if you have it. And you definitely, because there's an asterisk here, you definitely have to add a cell phone number. Otherwise, the system will not allow you to register this one. It's compulsory to have. Going to put my cell phone number, and then I'm going to put my email address. You have to put in an email address. And then the last part is capacity to vaccinate. What this means is if the health facility that you're registering here has capacity to vaccinate, you are going to tick this part and say it has capacity to vaccinate. If it doesn't have capacity to vaccinate, you just leave it without ticking there. We know that there are some organizations that are assisting. They work in collaboration with existing facilities. So sometimes it becomes necessary to say, we do not vaccinate. You indicate that you don't vaccinate. You don't have capacity to vaccinate. And then you just continue. It's important for the system to know that this particular facility doesn't have capacity to vaccinate. And then In my case, I'm going to say no capacity to vaccinate, so I'm not going to tick this part. And then you definitely have to tick this part which says terms and conditions accepted. At this point, you're done. I think it's important, maybe you might want to review the information that you've put in here. You just have to now specify your address, starting with the province, right? I'm going to say this is Johannesburg, and the suburb, I'm going to Cosmos City is not here, so I'm just gonna select any. I'm just gonna select any suburb here for the purposes of this training, and then you put the address. It's Lily Avenue, and the next and last thing is that of saving. So I'm happy with what I've provided here, so I can select the save button. It says, the system says, are you sure you want to save this facility? I say, okay. So here we are. The name of my facility is Zone 18 Cosmos City, as you can see, and it's active, and there is no one uploaded at the moment. You can see there is no number here, right? So we can also see that capacity to vaccinate, it's written that. I want to just scroll to the right here. It says false because I chose not to say it doesn't have capacity, and the registration number details are all there, the ones that we added. So the first part is done. We've created a facility. That's how we create it. And then how do we upload? I think we'll start by uploading before we start sharing. So there is a button here which says upload. So you select this button for upload, and then it takes you to this part where we can begin to see that there are no entries found here. There are no files as yet. So what we need to do is we have to create a file and start uploading individuals. On the top right-hand side here, we can see there's a button for create a file. So we click on this button, right? Maybe before I do that, I just need to mention that this page where we are right now, it's written program uploads at the top, and we go on to this far right and we select the button which says create a file, so that we create a file. So when we're creating a file, it means we're now adding this particular individuals who need to be registered. So we're going to start with, let's start with Neo, and we're gonna put the surname, surname, where it says ID number, passport, refugee number, all these numbers, we know that our undocumented citizen doesn't have, so we ignore all that part. And then we come to this part where we specify the date of birth. So the date of birth, you can either type it or you can just click on this calendar here and select the appropriate year, the appropriate month. So this one will say 1st of November 1977. And gender, we can specify here that this particular person is a female. And then if some undocumented citizens have cell phone numbers, you can put the cell phone number. This means they will receive an SMS. They will get their registration number via SMS. And if they don't have a cell phone number, it's fine. It means you write this particular registration number down for them on their vaccination card. And the next thing is you have to specify if they have medical aid. If they don't have medical aid, you still have to specify that it's none, right? You select this part which says none. If you don't do this, if you leave it blank, you'll have a problem trying to upload this particular individual on the system. So because I selected none, it means there is no medical aid number. So I'm going to select the button which says add. Already we can see that Neo is added here, and this is the registration number. And at this point, this registration number is not yet on the EVDS system per se. You need to go through the process of processing it and approving it before you can be sure that, yes, this is going to work, right? So we're going to add one more person again. So we go to the top here. This time we're adding, let's add Brian. I'm looking for short names. And let's say we go all the way up to specifying the date of birth. This time it's going to be 1983 in April. Let's say 15 April. Okay. And the gender this time is male. Cell phone number, I'll say they don't have. Medical aid, this time I'm going to say this person has got a relative maybe who put them, or maybe their employer put them on bonitas. Sometimes you might miraculously have people who have medical aid, and then you have to specify the medical aid number if you've specified that they have medical aid, and then you add, right? As soon as you add, you can see that line is added here. Let's just add one more person. We'll say, and then we skip all this part about registration numbers. We go to, okay, we can type the date of birth instead of using that other method that I used. You can see typing one. None. If it's in my case, I'm choosing that it's going to be none, and then I'm going to add. Right, we now have 3 people, and this file that we're creating is going to have 3 people. Sometimes you might have one or 2 or 20 people in one file. So it just depends on how big is your queue or what approach you decide to use in terms of getting these people uploaded onto the system. At the bottom here, there is the save button. So we are going to save. The system is requesting me to confirm. Here's the confirm button. I'm going to confirm here. Now, it's possible that you can download this file before. If you want, we can download this one at this point. Okay. Now, if you download, you can see that this file is coming up here. It says pending. If you want to open it, you can click on it and then it will take you to Excel because it's a CSV file. But at this point, I want to continue and click confirm. And it says the records have been saved. Now, after you've saved, it's possible to, what has to follow is that you need to process. But before you process, let me just show you that your file name is this one. It says your file name. It's named after the date and time that it was created. So this is your file name. And we can see here on processing, it says 0. Now, what we need to do is to come to this button here and click on process. Are you sure you'd like to process this file? I say, okay. It says 3 of 3 rows processed. Sometimes it might process 2 out of 3. It just depends on how you entered how you typed in your names, and if there's something that's not done correctly, it's not going to be processed. So at this point, we can scroll down further to see the results. it says here, true, 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 meaning to say everything is correct. If there was something that was not processed, it was going to say false, and then you will have to make a decision of whether you want to approve, because after processing, you have to approve. If you approve, it means everybody that is true is going to be processed, and their registration numbers will become immediately available on the EVDS for people to proceed and be vaccinated. And then if you decide to reject it, it means the process will go back a few steps back, and then you can make corrections on the individuals that are labeled false, because when it's written false, there will be also a reason to say maybe you did not enter the medical aid number since you specified that you have medical aid, or maybe you did not add the date of birth. So if you don't add the date of birth, you will have a problem, because the system won't allow you to proceed, right? So it's important that the undocumented citizen provide that date of birth. So the next thing that you have to do is select the button for approve, because in my case it says true, true, true. So I'm going to approve. It says, are you sure you'd like to approve this file? I'm gonna say okay. But before I say okay, I want to show you that this particular button here for downloading is still available. Okay, let me just do this. You can, at this point, if you download at this point, it will also show you who was successful. In other words, the name that will have the true and the name that will have false. And the importance is that if there are people that are labeled false, it means you have to go to those individuals and try to reprocess their names again because they were unsuccessful. So it's important that you can download at this point and have a record of who was successful and who wasn't. So I'm going to select approve, and then I'll say okay. It says 3 of 3 processed successfully. So which is very good. So we can now come here at the top, we can select back, and then when we go to our facility, that is Zone 18 Cosmos City, we can see that we now have three uploaded persons. Which is different from the time that we started. We had nothing. Now we have 3 people that we have on the system. The next thing is, if we wanted to view who is in this facility, we go to this button which says View Persons. If you click on View Persons, you can see that these are the 3 individuals that we added, Neo, Brian, and Jane. And we can see their registration numbers in case they've lost the piece of paper or the vaccination card that they had. You can actually write this down for them again, and we can see the details that they provided when we registered them. And it's possible to now select the back button, and we can see we now have, remember we had 3 facilities when we started, we can now see that it's 4 facilities that I have. The last part is that we need to show you how to share these facilities. So at the bottom of your list of facilities, you will notice that there is a button for share access. So if you click on this button, it will open up a little bit, and then you will have, it says no entries here, but there will be a list of, on the live system, there will be a list of undocumented citizen administrators. And if you type in the cell phone number here of the undocumented citizen administrator, the name of that particular undocumented citizen administrator is going to appear on screen here, and then you can select that name and then you can save. And that is how you share your list of facilities with that particular undocumented citizen administrator. Sometimes you work for the same organization and you might be away on leave or for some reason, but people have to be able to continue working. They might need to have access to that information that you worked through the previous day. And that's why it's important to be able to share your facility with somebody else who is also you. It's not somebody else ordinarily, it's somebody else in your organization who is also an undocumented citizen administrator. Otherwise, it's not possible to just share access to somebody who is not on the system. So I believe that covers it for the 4 main items that we set ourselves to go through. And at this point, we will offer an opportunity for colleagues to ask questions so that we might answer or provide clarity when necessary. Do we have any questions at this point? Is the cell phone, I'm now reading on the chat, there's a question which was put on the chat here. It says, is the cell phone number not compulsory? The cell phone number is not compulsory. The cell phone number is optional. It's not every undocumented citizen who has a cell phone. It's for that reason that as a way of making it easier to have this particular sector of citizens to be vaccinated, that requirement is not compulsory at all. I can see we have 27 participants in the meeting, including me and Archie. But we have, let me just check how many people we have. The last time I checked, we have 20. Oh, that's better. We need at least 5 more people to register so that all of you are registered into the meeting. We expect to have a record of everybody. Do we have any questions, colleagues, before I move on to the last part? Those who haven't registered, colleagues, you're supposed to follow the web link on the chat in order for us to have a record that you attended training. There's another comment or question. It says one of the EVDS functions is to reconcile payments. What payments are we talking about here? Okay, I think this question is picking it up from the overview that I gave in the beginning. When I gave the overview, I wanted you to understand where undocumented citizen administrator role belongs. So I also indicated that undocumented citizen administrator belongs in the registration and scheduling component of the EVDS, right? So, and when we're speaking about registration and scheduling, you obviously are not going to be doing anything related to reconciling payments there. However, the records of, if you go to the component on the on-site EVDS component, the records that comes out in terms of the vaccination events that are recorded on the on-site component, they help organizations to keep track of how many vaccinations took place. And how many vaccinations they've managed to do. I think some have targets, and out of that particular record, they can make a reconciliation about how many vaccines they've used. And remember that the private sector or the medical aid societies want to prove to government that we have administered so many vaccines, and from that information they are able to make arrangements, or what do they call it? I'm trying to find the correct word. The government is saying vaccines are supposed to be for free, but there is a payment between because the medical aid society are actually involved in the administering of the vaccines. They have to be compensated for that, but not necessarily for the vaccines. So there is a formula which they use in terms of making sure that if we vaccinate so much, we get so many vaccines. So the system allows us to keep track of how many vaccines have been administered, so that they always try to balance out those numbers and make sure that the cost associated with this particular vaccination work is reconciled properly and done properly. I hope that answers that particular question. I can see another one here. It says, what is the importance of sharing information with? What is the importance of sharing information with the undocumented administrator? Okay, undocumented, you want to say undocumented citizen administrator. I think I did cover that part. I said that sometimes some organizations are big. If somebody shares, if you share the facility that you created with somebody else, it means they will be able to see the names of undocumented citizens that you've added onto the system, and they will also see the registration numbers. So you might be working on the same list and you want to keep track of who have we added and who haven't we added, right? Again, if you are not available at work, somebody has to access the records. You could be unavailable because you took leave or because you fell sick. So it's important for somebody to be able to access the records and still facilitate the work of individuals. So I think that's the essence or the importance of actually sharing your facilities. And when you share facilities, you don't share one, you just if you look at the list that I had there, I had a list of 4 facilities. So you can't share one facility, you share all the facilities that are under your profile. So that particular individual that you share to will see everything. Is it possible to get the recording of the training? Yes, it's possible to get the recording of the training. If you registered into this meeting, it means we have your email address. We will share the web link of this particular training if you need it. Will you be repeating this training and when? This particular training is organized on an appointment basis. For example, we have on-site EVDS training. It's done every Thursday at 1 o'clock, from 1 o'clock to 2:30. But undocumented citizen administrator training, you need to request you need to send an email and request training, and then we normally proceed with training when we have at least 10 people who are able to join. Otherwise, if the number is smaller, we'll have to wait for another request to come through so that we at least train more than 10 people at a time. I will share information on where you can find the recording though. So in the meantime, whilst you wait for your 10 to be trained live, like what we're doing now, you will have access to a recording of previous training sessions, and then you can go through that material. I'm just trying to, this is slipping away. It says on adding, there's a comment here, on adding the facility, how do we know the registration number of the certain facility we want to add? I think if you want to add a facility, like we said, let's say you're working as a private facility, or even an NPO that also that is registering. Your organization's registration number is the registration number that you add onto the onto that slot where you're supposed to add registration number. And how do you get to know that? Is you ask whoever is CEO or manager in your organization, they'll give it to you, and then you can add it. I don't know whether I'm missing maybe the question, but I think every organization or even the public facilities, I think they do have a unique number that sort of identifies them from one here in Joburg to another one, which is somewhere in Pretoria or even in the Eastern Cape. Another question, I need staff trained in the Eastern Cape. The number will exceed 10. Send us an email and we can decide on the most appropriate time, as long as it doesn't conflict with other training that we have. We can sort of arrange a session so that your team receives training as soon as possible. Last comment here. Okay, I'm going to come to you. Okay, it's Wendy. So Wendy, I was just reading your comment, so it's fine. You can go ahead. You can unmute. And
yeah, just to say that managing undocumented is one of the biggest issues that we're coming across with integration into routine healthcare services. So actually, this is an absolute priority issue for us. So we're just going to need to schedule it quite soon, please, and preferably next week. Maybe from your training division, if you can give us a list of potential times, and I'll take it through my VPMO meeting this evening. Thanks.
Okay, I think you can, let me do it this way. We can do training. I think Mondays are normally a challenge because you need to give people time to know about the training. We can do a training session on Tuesday, Tuesday morning. I don't know whether you prefer morning or afternoon. So
how would Thursday work for you, Becky?
Thursday next week.
Yeah.
I have training on Thursday at 1, so we have to do a morning session.
That'll be fine. I'll notify my staff and we'll have as many people as possible onto that call.
Okay, so I could, if you send me an email, and then
sure, I'll do that. Okay.
I'll set up a
right.
meeting and then I'll reply and share.
Okay, perfect. Thank you very much.
Okay, I see another hand. Melinda, go ahead.
I'm Becky and Wendy. Will the Western Cape staff also be able to join this training session next week? Will that
would
be
make
fun?
sense? Would make
Yes,
sense.
Thanks.
Yes, if you'd like to join, you also make sure you send an email to indicate that you need the training, and then I'll make sure that I share the meeting invite for the next week's Thursday session.
Perfect. Thank you very much.
Okay. So Let me go back to the comments. I thought there were still some more. Let me just check again. What do we have here? Okay. Should I facilitate the train? Who should I facilitate? Okay. If I think we've answered this particular question from Wendy. I think this one is sorted. Okay, that was the last one. So I don't see any hands. I'm assuming that we are all covered on this one. So I'm going to go to the last part of the presentation now. Let me just go to our last part. So after the demo, it's important to show you that there is this website. It's called hissupport.health.gov. This is where you find the user support package. So by user support package, we mean the presentation that I shared today, the recording of a training session such as this one is there already on the His Support, and you can access that by going to hissupport.health.gov.za. You look for EVDS training, and then under that, you will find that there is undocumented citizen administrated training that you can actually access and make sure that you refresh your memory about the content of today's training session. And I'm assuming there are no more comments and questions at this point. That sort of brings us to an end, but I'm going to just go back to the chat platform to check one more time. Let me check again. I want to check, where is that? Okay, I don't see any hands or comments here. The last plea that I am going to make is that, can we have everybody who attended training register, because we need to have a record of who attended training. Some of you, we get provinces contacting us to say, give us a record of who attended training, and then it becomes a challenge if we can't find your name. But thank you very much, colleagues. Thank you for coming through and for participating. The questions help a lot for people to understand better, and I hope you have a wonderful day. This training comes to an end at this point.
Sorry, Mbeki. There is one question from Joseph. What is the criteria for one to join this training?
I'm not sure I quite understand, but let me try to answer the question. This training is for undocumented citizen administrator. So how does one become undocumented citizen administrator? You have to have been nominated by your health facility to be the point person responsible for registering undocumented citizens. So once that happens, once you've been nominated, you apply for the role, right? Once that particular role has been approved for your health care center, for your health facility, it means the next thing that you need to do is you have to attend training so that you're able to, once you receive the credentials, that is, you get to be able to navigate the system to do your work as an undocumented citizen administrator. So you have to have been nominated, you apply for the role, you get approved, and then once you're approved, you get to attend training, you receive your credentials, and then you access the system. That's how it's supposed to work. And if you want to attend next week's training, you just send an email so that you join together with the other two colleagues that said they want another training session. If you send an email to indicate that you need to attend training again, we'll make sure that when the invite goes out, your name is also included. Okay, thank you very much, colleagues. Have a great day. This training adjourns at this point. Thank you.
Cheers, man.
Cheers.